Many thanks to Dr. Janet Pearl for sticking around today, because she did a Facebook Live on the sclerosing, and did I record it correctly? No, I didn't. So my apologies. Thank you very much.
It's okay.
So we decided, so since I just did a little bit on the sclerosing, we're going to talk, or Dr. Pearl's going to talk about what is a stump neuroma and what isn't one, and what constitutes a stump neuroma and why it needs attention with ablations and PRPs and so forth. So take it away.
Are we recording?
We are recording.
Yes.
I can see it all now, and I'll just have to hit it all correctly, but yeah.
So, there is sort of a misunderstanding that a stump neuroma necessarily is the same kind of neuroma that was there. Well, actually, I should back up a lot. Yeah, before surgery. So a stump neuroma can occur after surgery.
Yep.
Typically, the surgeon will resect or cut the neuroma and resect back proximal or the ankle side of the metatarsal heads, or those are the knuckles of the feet.
Yeah.
And it's the nerve between the knuckles where the neuroma occurs.
Mm-hmm.
So by cutting the nerve behind the knuckles of the feet, the metatarsal heads, often the surgeon will bury the nerve,
The end of it.
the cut end of it into surrounding muscle, because nerves will tend to continue to grow, and they look for things they grow to attach to something.
They're like roots.
Yes.
Kind of like roots.
Kind of like roots of a tree.
Yeah.
And if they attach to a capsule of a joint, it can become very painful every time the joint moves. These nerves can send pain signals.
And the capsule of the joint is like the covering of the joint.
The covering of the joint.
The covering of the joint, yep.
So the idea is to bury it into soft tissue where it won't grow to something that will trigger pain.
Yep.
So a neuroma is basically a nerve ending that can spontaneously cause pain messages to form. So it can be a thickening of a nerve, like in the case of a Morton's neuroma. It can also be sorry, somebody just walked by.
I know. Yeah.
It can also be just nerve endings that form. So even though a stump neuroma could be a budding of at the end of the cut nerve, or it can be just branching of the nerve that behaves like a neuroma, meaning it spontaneously fires and causes pain signals.
So it doesn't actually have to be like a bulbous thing.
It doesn't have to be.
But the end of the nerves I call them rogue pain signals. Like pain signals that shouldn't be happening. They're kind of like bad children. That they're doing things that they don't need to do, because pain is really a protective mechanism. So we need pain.
Right.
But in this case,
it's a dysfunctional.
It's a dysfunctional
pain signal, not serving any particular purpose other than irritating the person who's experiencing it, and preventing them from
what they want to
be doing.
Yeah.
So, so for us, these ablation techniques can be very helpful. They're often hard to see. They are not always visible on.
The stumps.
Actually, the stumps aren't always visible either on ultrasound or MRI, but we know that they're there because they hurt.
Yeah.
And these ablation techniques can be very helpful. Again, it's trying to find where they are and getting my needle tip or my probe tip in the vicinity of that nerve ending. And that's the challenge. But we're actually doing a lot better than we would do for people who have stump neuromas after surgery. And again, it's pain after surgery.
I'm really impressed with the number of times we actually do one ablation, one PRP, and people feel significantly better.
Yeah.
Because in my mind, it's not just a plain neuroma, right? Because
it's harder. It's harder to access, harder to find, and not always visible.
It must
Most
be
of
that
the time
PRP.
not visible.
It must be that PRP that puts it over the edge for pain
somehow it's
reduction.
the combination.
Yeah. PRP is platelet-rich plasma, which is again a kind of an autologous or a natural part of the human body, your own body, that we put back into your foot that helps it really jumpstart its healing properties. And so both of them really need to be done when we do a PR, when we
We've
do
been
a
doing
post-surgical.
them together, and I feel, we've had a few people who have wanted only ablation, and I feel like we've had much better results when we've done the PRP with an ablation in combination.
Because there's two sources of pain. The scar tissue and the rogue nerve.
Right.
So you need to, if you really want to walk away and feel significantly better, you have to give yourself the chance of having both pain conditions treated.
Right.
Yeah.
And the platelet-rich plasma is concentrating. It's getting the concentrated layer of blood that contains platelets, but also growth factors, cytokines, things that can stimulate and propel the healing process and sort of jumpstart it where it has stalled.
Right. And can you talk about when what we say to people who've had the post-operative, when they want to come after they've had a surgery, we ask people to come with an MRI. And one person mentioned recently that they didn't tell the office where they had the MRI done what was being looked for. But we decided recently that we should say to them, please look at the tissue.
Right.
As opposed to don't go looking for a neuroma after you've had surgery, because they could be very difficult to visualize.
Right.
So the radiologist
we
may
want to
say,
look at the interspace. We want to, where the neuroma was resected, we want to look for signs of infection. We also want to look for other structures in the vicinity that could also be causing pain.
Right.
But we probably want to be looking proximal to those metatarsal heads.
Right.
For any abnormality. But again, it isn't surprising at all that a stump neuroma is not visible. It doesn't mean that
it's not causing
it's
pain.
not there.
Right. Doesn't mean that something is not wrong in Denmark and causing a lot of pain. Okay, great. And of course, somebody that has been, Matthew's story of how much...
it's a great story.
Yeah.
But we have other people.
I know.
Not everyone has given a testimonial.
No, not everyone's given a testimonial.
He's
But he was pretty impressive because he had the two surgeries in the one foot. So, done on the same day, I guess. Probably, yeah.
And he was very incapacitated. And the level of function he's achieving is just wonderful.
Yeah.
He's not alone.
No, he's not alone by any means. He's the one that everybody kind of knows because he's on our website and on this group. But all right, well, that's really so
helpful.
helpful.
I
so appreciate it. Thank you very much. Stump Neuromas and PRP. There's some reasons why.
Okay.
All right, take care. Thanks.
Okay, thank
Bye.
you.
And here we're going to hit finish.